you in Fountain of Youth, brother.
That's it, man. That if you just want to start somewhere and you can bring that up, you can mention that in this podcast because I'll tell you that straight away.
We can start
Yeah.
with it.
All right. Yeah. So I got to tell you this one too. My brother and I were watching this deer hunt video one time. Are we kind of going into it? So my brother and I were watching this deer hunt video, and this old Mississippi boy, he's in a blind on the ground, and he takes this buck down with a bow, right? And he says something along the line of this. Yep, he said, that old buck come around the top of that hill right there all loaded up with testosterone. He was thinking testosterone. Testosterone. He was fired up, lined up on that testosterone. Yeah, so I'll never forget that. That was 20-something years ago.
Is it true? I heard somebody, I don't know if it's true or not, but I was watching this like little comedy clip or something. It was like Joe Rogan and Bill Burr, and Joe Rogan was talking about eating elk, and he was like, have you noticed your testosterone being up from eating that? And he was like, no, you idiot. It's just meat. And I didn't know. Is there a correlation in that? Or?
Well, yeah, that's true. I mean, that's a good point too. By the way, yeah, so hey, let me jump on that one because that's the thing with T. If you we didn't have low T and our issues with that for the most part 1,000 years ago because these guys were eating meat like that, and of course, producing children on into their 80s. So, and like we talked about too, if we mentioned lately about how the testosterone is dropping in men, like 5% or 5 points every 10 years or so now, right? So that's a good topic. Let's do that. Hello, everybody. Welcome to Flip the Script with Cameron and myself, Joey, Dr. J, and we're going to touch on a hot topic, as always. Let's talk a little male hormone today and the testosterone myth, and the term that's used so frequently, HRT.
TRT is what a lot of young guys are calling it too.
Okay, TRT, good, which stands for
testosterone replacement therapy.
Right, which it's not a replacement therapy. Think of it as restoration. So hormone restoration or testosterone restoration. We're restoring back. We're not replacing. We're restoring to optimal levels. And again, that's where the whole farce, if you will, where this optimal level came from, right? And the misunderstanding that most doctors have. So, man, this one is going to be hard to stop me on in 2 hours, much less 30 minutes. But, we can start with that there. So one of the first things I want to start with is that belief that there's some kind of correlation between testosterone and prostate-related issues, right? That increased testosterone or testosterone supplementation or restoration can predispose somebody to prostate-related issues. And, the first place I like to go with this is, let's just think about common sense for a minute. If elevated testosterone had a direct link between that and prostate-related issues, would it make sense that the 20-year-old or the young males be running around with the prostate issues, not the over 40 and over 50 male, where you find most of your prostate issues starting, and even greater as they move farther down the line?
Yeah.
And what's associated with that age growth or that age increase?
Lower.
Decreased testosterone.
Right.
So you're almost an oxymoron if you believe that there's a correlation between testosterone therapy, if you will, restoration therapy, and increased chances of prostate-related disorders. Now, a lot of people think, well, I got a growth hormone here, right? So therefore, am I going to increase the possibility of the growth of the prostate? Well, no. Because that prostate, basically that inflammation is really created from decreased testosterone, elevated estrogens. The estrogens we know are the pro-cancer hormones that we see, the problem associated with women. And again, when you look at the elderly man or the man who is at risk for these related issues, usually has those signs of elevated estrogens. Man boobs, love handles. You want to get rid of those? up your testosterone, people. Get your levels up. And one of the positive effects of elevated testosterone is increased lean muscle mass and decreased body fat. So, again, another reason why ideally we want to look into that. We can also touch on the numbers, man. The numbers that started 60-something years ago, which a great book that everybody should get is, especially doctors who don't have it quite figured out yet, Testosterone for Life. Okay, this book's been out now probably 10 or 15 years. Abraham Morgentaler, MD, he is a Harvard physician, and a lot of the stuff that came out of this book came out of the archives when they first started their hypothesis on testosterone and what they started teaching in medical school. And most of it is completely backwards, as you'll read in this book, and a lot of the things that we'll be talking about here, I also mentioned in my first book, Light Your Fire. So documented, not hypothetical, if you will. So great read for any male at any age, also for any physician, because let's be honest, most doctors going through school don't learn this. Endocrinologists more so, right? But a lot of them don't. So therefore, they don't feel comfortable in giving you a recommendation on something that a lot of their information that they have can be negative in a sense. So it's really interesting when you look at what they base the science on. But let's just talk about the number, 200 to what used to be somewhere around 700 to 1,000. Okay, so let's just hypothetically, we got 100 men in a room. All right, we find that the average numbers are anywhere between 200 and 1,000. So they say anywhere within this 200 to 1,000 range, you're normal. So you go to your doctor and you're 202. He goes, no, you're fine. Well, did anybody ask those people in that level between 200 to say 500 or 600 what they felt like?
Right.
Like maybe doo-doo, right?
Yeah.
Didn't feel like getting up off the couch. So even though this might have been a hypothetical number for the average male, it doesn't mean that's the way you have to live your life with inadequate testosterone as well as other hormones. So you, of course, want to have all of those checked and have them balanced out because there's a hormone. So give me optimal. I don't want average. Give me optimal, right? What increases longevity? What increases that by which most men consider themselves to be? Mental acuity, libido, high energy, lean muscle mass, all these things by which are a man. Not to mention, as I write in my book, almost everything that a man can die from, the possibility increases with low testosterone. You can look in the book there. I mentioned some of the symptoms associated with low T, and if you look at the correlation of that, if you want to read that, and with that you have hypertension, obesity, high blood pressure. We mentioned that. Low libido. Diabetes. What else you got?
High blood pressure, obesity, chest pain, high levels of blood clotting factors.
Yep, all those
low
things.
levels of blood clotting inhibitors.
Right.
High blood cholesterol, high blood triglycerides.
So again, you got it. And so listen to that list there. High cholesterol, the obesity, all of these. Think of how many drugs these doctors actually have that they can prescribe to you for symptoms of low T. So you can bet the makers of the pharmaceuticals don't really want to educate most of your physicians on low T, because if they do, here comes a lot of medications, maybe a half a dozen, that you will not have to be on if you get adequate hormone level balance of testosterone. And again, one of the key ones is that elevated cholesterol. And I go detail on this one. People, as your hormones go down, as you'll find with low T, your cholesterol makes all your hormones. So does it make sense that the physiology is to raise the cholesterol? But if you're going into your doctor, here's the scenario. They draw blood on you. You come back in for your report. Most of the time, unless you ask that doctor, he's not going to test your testosterone, estrogen, and other hormone levels, maybe vitamin D. When you come back in for your report, he tells you, oh, we've got to put you on this cholesterol-lowering drug because your cholesterol is elevated. Well, hold on a minute, doctor. Time out. What's my testosterone level like? If he seems to think that doesn't matter, that's your choice. I'm running because this guy obviously doesn't understand the correlation between hormones and cholesterol levels. And I've found over time, you're really, sadly, wasting a lot of energy if you're going to try to convince this guy or woman of a mindset that she's been
I've experienced that with doctors.
Drilled into them by the society, right?
Yeah, don't try to talk your doctor into a new state of mind. Just go find a new one.
That's right, exactly. Because those just have to die off with time, and somebody else will come in, the new generation, with a light attitude.
Yeah, I went from, I had a nurse practitioner, and they had maxed me out on a couple medications and stuff, and then I went to a new one as MD, and first thing she does, she's like, why are you taking 40 milligrams of this? And I was like, I don't know. They just said, do it. And I was like, they're the doctor. And she was like, all right, well, let's go ahead and take you back down to 20. We're going to wean you off of that. If that's
what
cool
was
with
it
you.
for? What was it?
It was an antidepressant. And 40 was the max dose. And I was like, she was like, because, you don't want to be on that forever. I was like, yeah, good deal. And she's like, all right. So, and she, more holistic approach, less is more type of thing versus...
Yeah, exactly. Exactly. And when you're on something like that, and you're on a particular medication, which we call for chronic related issues, try to maintain the lowest dose possible, right? And also try to get to the underlying cause of that. And that's another good point. Low T, a side effect of low T is depression.
That's
right.
I have a story about that.
Especially if you don't feel like getting up off the couch and going to exercise to increase your serotonin and also overall well-being.
Yeah.
Side effect of that, of course, another side effect of low T is, mood disorders. Big time. As a matter of fact, a lot of my patients will come in, the females, and say, Doc, can you get him back on his testosterone? Because he's become a pain in my butt, ornery. So, that's another key thing. And I'm personally, longevity, and I also, the other thing that I'm pleased with over the last few years, that now a lot of the blood studies are coming back and recommending the testosterone level around 900, which is great, because I've always said since the very beginning, I'm always want my patients to shoot for 700 or greater, right? So now the studies are coming back. Why do they choose 900? Well, the very interesting thing here is that they find that the 900 testosterone level is the adequate level for the 20 to 29-year-old male, which is a place that most everybody would like to be. And the beautiful thing about hormone restoration, you can maintain youthful levels of testosterone into your 90s. And if you think I'm kidding, ask 90-year-olds who are on it and ask them how they feel compared to the 50-year-old who's not. So you want a longevity supplement, have your testosterone checked. Again, like I said, everything I find that a man can die from early increases with low T.
Going back to something you said about testosterone causing, just mental health issues. It's kind of funny because
low T.
Low T. Yeah, one of my best friends, his dad, was depressed, and they put him on an antidepressant, and it was wasn't until 2 or 3 years later, and they found out it was low T, and they put him on testosterone, completely fixed it.
Oh, changed man.
The pill didn't do anything for him, but the testosterone, he was like, oh yeah.
His get up and go was there, right? His libido was there.
He said he started he said one time his little brother, who's a year younger than me, so he's 24, bumped into the dad, and the dad was like, Right when he got on testosterone, he's like, don't bump into me, because he wasn't used to
Yeah.
feeling so young again.
Well,
He's like,
that's the other thing too. And, there is that myth out there about sometimes elevated testosterone is going to make people into this monster type.
No,
you know what?
no. It just makes you feel alive, actually.
Well, it does. And, anything abused, there's, it can be. Mm-hmm. And if you go into aggressive state, then if you get your level up, that's say around 1,500, whatever it might be for some people maybe 1,200. Stop taking it. Bring it all back down if you feel that's the case. But you'll find for most people, it's the opposite way. And it's the same thing. It's like you get somebody with just a bad personality and you give them alcohol. It's not necessarily the alcohol. Yes. It's the bad personality,
right?
Exactly. Okay, so the 100%. Same thing. You give somebody a libido boost or a little bit of positive insight into their own selves, and they've still got some demons in their closet. Well, they're going to come out.
Well, it's interesting you said that the higher levels, because he had told me this. He said that, and his mom's a nurse, so the fact that this happens pretty crazy. But they were accidentally giving him double the dose, and his doctor was like, "Your heart could explode. What are you doing?"
Yeah, which is that's not going to happen. But here at the same time, I mean, again, everything in moderation. You got to bring it up, and this is one of the sad things about a lot of testosterone. A lot of these doctors are so fearful of it. They'll put these patients on this, what we call a half a cc or 100 milligrams instead of 200 milligrams a week, and after the shot for about a day, they feel good because it brings the level up a little bit, right? Mm-hmm. But then it's not enough to sustain the levels to bring them up high enough, so they go through this yo-yo up and down roller coaster because the doctor doesn't understand testosterone, and here the patient really needs to load on the front end and get his levels up sustainable to where he can now maintain these levels and he feels good all the time, right? And the same thing, well, I've had a very interesting thing early, 20 years ago. I started noticing this component with some of my patients with elevated cholesterol. And when their doctors would put them on testosterone, but not adequate enough, their cholesterol levels would still stay up, and these doctors would want to keep them on a statin drug. I found that if we convince the doctors, hey, bring them up to double that dose, 1 cc a week, 200 milligrams, usually within about 4 or 5 weeks, that cholesterol was dropping. So there, like I said, again, the problem was in the hormone deficiency. Once you bring that up, again, then you'll find that most all hormone levels will start to come into balance. So Dr. Zugan, D. Zugan, sorry, Doc, for kind of beating that last name up, but Sergey, MD, cardiologist, great book here, Cholesterol, The Magic of Cholesterol Numbers. His studies, double blind, ran complete study, high volume patients, and then replicated the study again 10 years later or so when they went back in to perform it again, found that almost all elevated cholesterol conditions were associated with hormonal imbalance across the board. And he found that, because here's a cardiologist who's doing all these surgeries on these heart-related issues on patients. And what he noticed was he's doing just as much, if not more, bypass and cardiac-related surgeries on people with normal cholesterol. So how could this correlation of elevated cholesterol be the issue linked to cardiovascular disease? Well, guess what, people? It's not. It's actually probably, in my opinion, and if you read this book, you're going to find that it's more of a hormone deficiency related issue. So even these patients with genetically hypercholesterolemia, which means naturally high levels above 300, even greater, even when they took these patients and balanced their hormones, not just the testosterone in the man, but DHA, pregnenolone, and all of them, when they bring them all back into their preferred numbers, even the super elevated cholesterols would come down significantly. Not to that hypothetical number of 200 that was chosen, by the way, like I write in my first book, to recoup the money lost in research for the statin drug and the cholesterol. That's why that number was chosen for 200. 1/4 the population had a cholesterol level over 200. That's how that number was chosen, people. And they were bound and determined to get 1/4 of this population on that drug to make a profit. And now it's through the roof. $1 billion a year, something crazy. You don't even see the commercials on television anymore because everybody's on it. And again, look to your hormones for basically the causation of most all elevated cholesterol. Boom. It's in writing. Okay. So, again, that's how passionate I am with this. The myth, and also that myth, there is no correlation between testosterone use and a negative prostate in the field of the cancer. And most men who do develop prostate-related issues have low T, not elevated testosterone, and the same thing with prostate cancers in males, okay? Higher incidence of cancer associated with the prostate and low T. And again, that's the research done in this book. So, and I like to say, don't always listen to me. Do the research, educate yourself on this, and it's very enlightening and very empowering.
What about like the falling testosterone levels with young guys, especially over the last 20 years?
Yeah,
besides, I know lifestyle stuff's different. I know people are lazier and life's become easier and stuff.
Well,
but
you know what though?
That,
Yeah, right. There's less movement. But then again, the reason why is that here again, and we talk about how this is declining. And what is declining over the last 50 years? It's the food again. So when I have a patient come in, say a male, and he's got the man boobs, and he's got the love handles, and has a weight issue. Sometimes you can't jump into hormone restoration therapy with testosterone until you bring those estrogens down, because there is a fact that if the estrogens are elevated, you have to bring those levels down before you can adequately use testosterone therapy, because the testosterone can go downstream into the estrogens if the receptor sites are not adequate enough to absorb them, right? Or if they become too full. So for a lot of men, and also to be said, when you are using testosterone restoration therapy, your doctor needs to monitor all your hormones, well, preferably your estradiol. We want to make sure that the aromatizing hormone estrogen stays within a balance. All right, easy thing to do. And of course, if you need a supplement for that, then you supplement for that. But what you're finding in the youth now, like you're talking about, is these high processed carb diets and inadequate protein, like we were talking about when we first opened up here. This is causing the low T, the primary cause of the low T, that's dropping significantly every 10 years now, they say, right? So it's, again, like we were talking about in the last podcast, it's metabolical, right? It's our metabolism. But good question there. And that's why we're also starting to see these problems associated with low T earlier. It used to be something we used to deal with in the age of 60, right? Now it's 50, and now there's 40. And yes, I mean, it's, listen, I know of a doctor friend of mine who was treating a 17-year-old male for low testosterone. Yes. Can you just imagine that?
It's just
well,
like,
it is. It's possible.
I mean?
And, you know, here's another real interesting correlation. You know, in athletes today, you get somebody out in one of those corn-fed Nebraska boys, right? Eating all that steak and all that meat. All right, he's playing ball. And he's got this testosterone level of 1,200. Then you got another kid who maybe is in an area where his diet is really not adequate and eating a lot of carbs, done, you know, just because that's what they can afford. Sad but true. Now this guy, this young kid, they're both 17, 18 years old. One's got this diet high in testosterone producing nutrition, and the other one high estrogen producing nutrition. So now they're both on the field. Well, is it really a fair playing field for this particular guy who may have a testosterone level around 200 at age 17 or 18, right? And he's competing against the kid.
It's like the MMA fighter.
Right, exactly. So, you know, here again, due to diet and sometimes just sociological situations, some kids are playing with a testosterone advantage over those that are deficient in testosterone producing diets or estrogen elevating diets over their counterpart. So again, we're talking level playing field, because there is that question about the supplementation of hormones in sports, right? Understandable. But is society in itself really playing with a full deck? Yeah, something to consider. And that's why maybe we're trying to, well, not anymore, but the last 4 years we had males trying to get into female sports, right? Maybe their estrogen levels were just starting to compare with that. It's also a spooky thing, for a lot of my patients, who wind up with the man boobs and the love handles and stuff, when we get the blood work tested and we find that these estrogen levels sometimes are as high as their wives, that's an eye-opening experience right there. Yes, it is, right? So for longevity, balance, get your hormones restoration therapy. But find a doctor who understands. And sometimes it's good luck with that. You want to try to usually find somebody who is in, and you can find these alternative care doctors on websites, or look for people who do specialize in hormone restoration, which, sorry people, most of your general practitioners and even a lot of your, truthfully, endocrinologists are still misinformed. So sometimes you have to do your homework. Good place to start is education. I love this book. For the layperson and certainly for the physician who gives a damn. So, like I said, we can do 3 or 4 hours of this. Love this stuff. But for now, so we understand people have other things to do, right? Good topic. And so, again, everybody, thanks for taking the time. And on this one, opine, please. Man, we'd love to hear what you think about it. So until next time, I am Dr. J with Cameron, and we say have yourself a great day, as always, so you're not missing one. See you next time.